Thank you very much, Ciarán. And could I just say it's been a very heartening and uplifting meeting, and I just want to compliment each of our witnesses. You know, their commitment to their patients, their commitment to their profession is so comes across in every utterance that they have made, and I wish you well with the very, very important work that you carry out on behalf of our society. Indeed, as was said in your introduction as well, unfortunately none of our families have avoided the scourge of cancer through deaths and through illness as well. So it's a subject that's of huge importance to all of us. Could I also just say that your message here to the committee, indeed to the wider public, is that politics works, and it's the existence of the Good Friday Agreement allowed the cooperation to start in the first place with the Memorandum of Understanding, then funding being accessed from the Peace Plus programme, and now we have moved on to the Shared Island Initiative of An Taoiseach that will be crucial, I'm sure, in supporting your work on an all-Ireland basis in the future. Could I just also say that mention was made about at the moment with what the Cross-Border Health Directive, and as we know now, is the Northern Ireland Planned Healthcare Scheme that replaced the EU Cross-Border Health Directive that finished when Britain left the European Union, but the same process is in place. That's established on an administrative basis at present. In the new year, there will be legislation going through the Oireachtas to put it on a statutory footing. And maybe if the committee got some advice from yourselves in relation to bring in the need to facilitate trials under that particular scheme, maybe we could try to advance that on a cross-party basis when the legislation is being discussed in the Oireachtas. I'm very glad, as a long-serving member of Dáil Éireann, that we're talking today about the provision of cancer services on an all-Ireland basis, on a transatlantic basis, and across the European Union, and as the Ciarán said, hopefully further afield in the whole area of research as well. I was a member of government in the mid-2000s when we began a programme of rationalisation of very small cancer services that were in most of our county hospitals at the time and regional hospitals, and there was a huge opposition to the rationalisation of those services, and it was the right thing to do, to go and have services provided where you could have a multidisciplinary team. Some of us got a hell of a lot of abuse at that time for backing the proposals to rationalise and to provide a better service in less hospital settings, and that has worked, and naturally there's room for improvement. But alongside that development, then we had developments like chemo being delivered in Cavan General Hospital that we couldn't have had in the past were it not for the linkages with the Mater Hospital in Beaumont, and I'm sure that's replicated in other places throughout the country as well, and we want to see more of that when it's feasible. I just want to say that the fact that in the St. Patrick's Day meeting between An Taoiseach and President Biden, that President Biden referenced this work and this centre. Now, he didn't reference that off the top of his head because everybody would know in the speaking notes that would be prepared for such a meeting, they would obviously have gone through his senior personnel, the senior health officials as well. So that showed how eminent the eminence he thinks of the work that's going on by yourselves on an all-Ireland basis and transatlantic basis, and it's very heartening to hear that. Could I just say, when my first contact with some of the witnesses who are here today in regard to the development of the All-Ireland Centre, I thought maybe this was the idea of having a new building, a new standalone facility. I was delighted to know it wasn't, that it was using existing partners, not just in research institutes or universities, but you were using the hospitals, which are an essential part, naturally, of research and medicine. And when we saw the presentation there, it showed how many partners you have working together in collaboration. And I think it's a real model to show what can be done and what is being done on a daily basis to bring about improvements that we all want to see in the whole area of cancer care. And could I just say, a theme that I took from the meeting here today and from all the contributions, all of you, was the patient being at the centre and also equity of access. And I think they're very, very important and essential messages to go out in the whole area of the delivery of health care. And I think as an island, it makes common sense. It's heartening. It's progressive that we're working on an all-Ireland basis, that you're working on a transatlantic, particularly with the United States. And one thing that maybe Professor Lawler would come back upon, I think it was in relation to Stephen Farry's question about collaboration at a European Union level. Now, I know that back years ago when Mr. David Burton was the Irish EU Commissioner, and among his responsibilities at that time in the Commission was responsibility for health, I think he argued very strongly at that time that the competence of health needed to be an EU competence, because there were so many challenges coming up, so much needed to be done that countries couldn't do just having the competence themselves. And I think it was mentioned by one of the witnesses earlier about when, I'm paraphrasing now, when there was a global effort to develop a vaccine in relation to COVID, that has been successful. And we're talking today about a booster vaccine after more than 90% of our population has had their second dose. So that showed the success of science, and it showed the importance of the global effort, and governments throughout the world putting the necessary funding into such work as well. And to just conclude a Cathaoirligh, I just quote from the initial comments of our witnesses in relation to the vision of the All-Ireland Cancer Research Institute. And I quote, "We will become a global leader in cancer research, and as a result, we will give much needed hope to patients with cancer and their families." It's a very heartening message, and hopefully not just those of us in public life, but hopefully the public at large would hear that message as well. So good luck with the very important work that you do on behalf of all of us. And naturally, as the Cathaoirligh said, and as my colleague Senator Erin McGreehan said earlier on, we want to support you in your work. Thank you, Cathaoirligh.